I'm going to take my mask off. I am vaccinated, and I will say that any of us that have our masks off have been fully vaccinated. So, walking the walk. So it's an honor to be here today. Senator Reed, thank you for bringing us together. So let me be clear from the medical standpoint that the Delta variant is bad. We've seen an approximate 60% increase in new COVID cases across the country over the last week. The emergency departments and hospitals in Missouri and elsewhere across the South are now filled. I'm hearing from my ER colleagues across the South that what they are facing now is worse than the surge that they faced during the winter. It doesn't compare yet to what we had here in Rhode Island, but they are feeling overwhelmed in the same way that we did in November and December. The Delta variant causes about 1,000 times greater viral load in people who catch it, which means they get sick faster. It also means that they're able to spread it more quickly. It's somewhere around 40 to 60% more transmissible. So you're more likely to catch it if you're around someone with Delta variant. But the vaccines work. Across the country, even in the states with growing loads of Delta variant cases, about 99% of the cases are among the unvaccinated. And the same thing is true here in Rhode Island. The people who are being hospitalized today, as Senator Reed said, are by and large the people who are unvaccinated. But here's the thing, with the Delta variant, just getting one dose of the Moderna or Pfizer doesn't cut it. You have to be fully vaccinated. You have to have both doses. Although the vaccines still protect you, you need to finish your course. The single dose of Johnson & Johnson still seems to work pretty well. Here in Rhode Island, about 60,000 people have gotten only their first dose and not their second of Moderna or Pfizer. So it's critically important for us to show up and finish those vaccination sequences. I do want to give kudos to our state, federal, and local officials and mayors, especially here in Central Falls, for getting folks vaccinated. Really, as has been said, our numbers here in Rhode Island are truly outstanding compared to other states, but they are not yet where we need to be, especially if you look at younger people. If you look at folks who are under 50, only around 45% of them have been vaccinated, and the percent that's been vaccinated goes down as you go down into those younger age groups. That's because they think they're invincible. I can tell you as an ER doc, they are not. Even if you are in your 20s, 30s, 40s, or even your teens, you can still end up very sick and hospitalized and with long COVID from this virus. And now more than ever with the Delta variant, it's important to show up and get those vaccines in arms. As the mayor mentioned, there are some parts of the state where vaccination rates are lower. We have some towns where vaccination rates are 80 or 90%, or if you look at Block Island, well over 100% because they're also getting the tourists, right? But here in Central Falls, it's only around 50%. And I can tell you that I worked yesterday in the ER and I saw a number of people who had not yet gotten their vaccine. I had long conversations with them about their reasons why they hadn't been vaccinated yet, their fears, the misinformation, and sometimes lies that they had heard from social media, from friends, and from family. And I changed a few minds. We gave out vaccines yesterday in our emergency departments because of those conversations. And so this would be my plea to the folks of Rhode Island. If you have been vaccinated, please have conversations with your friends and family, particularly your younger family members and friends, your coworkers. Talk to them about what the experience of the vaccine was like. Talk to them about the fact that it is safe and it is effective, and help them know where to go to get an appointment. Obviously, here in Central Falls, there are a lot of resources. There are resources across the state as well. And the best thing that we can do to protect ourselves so that we don't face another surge here locally, so that we protect our community members, so that we protect our kids who can't get vaccinated yet, our friends and family members who have cancer or who are on immunosuppressants who the vaccine might not fully protect, the best thing we can do to take care of them is to show up ourselves and get our first and second dose of either Moderna or Pfizer, or get that Johnson & Johnson vaccine. And in the meantime, until we're fully vaccinated, please wear a mask. Thank you.